Hey everyone, it's Jennifer, and I'm back again with another video on an eye disorder. So today I'm going to talk about Strabismus, Strabismus. Strabismus, also known as crossed eyes, is when your eyes are not lined up properly and they point in different directions. One eye may look straight ahead while the other eye turns in, out, up, or down. The misalignment can shift one eye to the other. Strabismus affects vision, since both eyes must aim at the same spot together to see properly. There are 6 eye muscles that control eye movement. One muscle moves the eye to the right, and one muscle moves the eye to the left. The other 4 muscles move the eye up, down, and at an angle, in order to focus on a single image. All 6 eye muscles must work together. So what causes crossed eyes? To line up and focus both eyes in a single target, all muscles in both eyes must be balanced and working together. The brain controls these muscles. People who have strabismus usually have a problem that can affect muscles. Some of these problems may include health problems such as diabetes, thyroid disease, Graves' disease, myasthenia gravis, brain tumors or a stroke, accidents or head injury, damage to eye muscles during some kind of eye surgery. Most adults with strabismus have had it since they were children, but sometimes it starts later in life. So how does it affect vision? With normal vision, both eyes aim at the same spot. The brain combines the 2 images from our eyes into a single 3D image. This is how we can tell how near or far something is from us. It's called depth perception. When one eye is out of alignment, 2 different pictures are sent to the brain. In a young child, the brain learns to ignore the image of the misaligned eye. Instead, it sees only an image from the straight or better seeing eye. As a result, a child loses depth perception. Adults who develop this after childhood often have double vision. This is because their brains have already learned to receive images from both eyes. Their brains cannot ignore the image from the turned eye, so they see 2 images. What are the symptoms of the adult crossed eyes? The most obvious symptom is having eyes that appear out of alignment. Adults with strabismus also may notice these other symptoms. Weakness in or around the eye, or feeling like something is pulling around your eyes. Vision changes such as double vision, seeing 2 of one image, blurry vision, trouble reading, or a loss of depth perception, constantly tilting or turning your head to see an image clearly. The symptoms can be constant or they can come and go. What is the treatment? There are several ways to treat this in adults. So there is a surgery. This is the most common treatment. Surgery can improve the eye alignment and help restore proper vision. Typically, it occurs when the muscles around the eyes are either too stiff or too weak. An ophthalmologist can loosen, tighten, or move certain eye muscles so that the eyes line up properly to work together. More than one surgery may be needed to treat this. Surgery is usually done as outpatient surgery in a hospital or surgery center, using either general or local anesthesia. Your ophthalmologist makes a small cut in the tissue covering the eye to reach the eye muscles. The muscles are then repositioned to help the eyes point in the same direction. This may need to be done in one or both eyes. After the surgery, you can get back to your daily routine in a few days. Then, there is also eye muscle exercises. The ophthalmologist can teach you to exercises to help you focus both eyes inward. These exercises can help if you have convergence and insufficiency. That is when your eyes do not align properly for close tasks like reading or computer work. There's also prism eyeglasses. A prism is a clear wedge-shaped lens that bends, refracts light rays. A prism can be attached to eyeglasses or made as part of the lens. Prisms can help some people with mild double vision to see one image, not 2. Then there's also Botox. In some cases, an injection or a shot of Botox in the eye muscles can help treat strabismus. It paralyzes the muscles that keep your eye from aligning properly. The effect can last for just a few months, or it could permanently improve your alignment. It is never too late to treat strabismus. If you do not have to live with the discomfort and problems caused by the misalignment of eyes. With your ophthalmologist's help, you can find treatment for your strabismus. That's very important. And then there's also strabismus in children. It is the same thing. The crossed eyes and all that, and how it affects the children. But with children, the signs, you may notice the child's eyes look different directions at the same time. You may notice that the child closes one eye or tilts their head when looking at an object. This may be your child's way of getting both eyes to work together. Your child may squint with one eye when in bright sunlight. Your child's pediatrician, school nurse, or teacher may notice these signs too. If you think your child may have strabismus, contact a pediatric ophthalmologist for a complete exam. Then there is pseudo-strabismus. When children are less than a year old, their eyes may look crossed when they really are not. This is called pseudo-strabismus. It usually happens if the child has a wide, flat nose or a fold of skin at the inner eyelid. A child can outgrow pseudo-strabismus. Just letting you know. Okay, there are different types. Strabismus types. Infantile esotropia, when a baby or young child has eyes that cross inward. Accommodative estropia is the most common type of strabismus in children over 2 years old. One eye may turn inward toward the nose when focusing on a close-up or distant object. Exotropia, when one eye turns outward away from the nose when looking at something far away. This can happen sometimes when a child is tired, sick, or daydreaming. A child might also squint with one eye in bright sunlight. Alright, the treatment. One or more types of strabismus treatment may be recommended depending upon the child's age and eye alignment. Babies and very young children with an inward turning eye, esotropia, may need surgery or glasses. Strabismus surgery on the eye muscles helps align the eyes properly and allows good vision to develop. Children over 2 with esotropia may be prescribed special eyeglasses to help focus and straighten the eyes. Occasionally, prisms are used to help focus as well. Prisms is a clear wedge-shaped lens that bends, refracts light rays. A prism can be attached to eyeglasses or made as part of the lens. Patching or blurring might be recommended to help strengthen a misaligned eye that is weaker than the other. The child is prevented from using their stronger eye by wearing a patch or using blurring eye drops. This forces them to use the weaker eye, helping to strengthen it over time. Sometimes children are taught to do certain eye muscle exercises to help focus both eyes inward. If glasses, prisms, patching eye exercises do not help, then surgery may be recommended. Surgery is often done to correct the alignment of a child's eyes. It is usually done in an outpatient surgery center. Your child will be given general anesthesia. The ophthalmologist makes a small cut in the tissue covering the eye to reach the muscles. The muscles are then repositioned to help the eyes point in the same direction. This may need to be done on one or both eyes, and some children may need a second surgery to align their eyes. After surgery, most children can get back to their daily routine in 2 to 3 days. As with any surgery, there are risks. While rare, they can be serious. Your ophthalmologist will discuss these with you, and will discuss the risks and the benefits with you. Strabismus surgery is usually a safe and effective way to treat misalignment. However, it does not replace eyeglasses, patching, or blurring if the ophthalmologist recommends them to. Strengthening your child's eye muscles is very important for good vision. So that is a little bit about strabismus. And stay tuned, I'll be doing more eye videos. In the meantime, please stay safe, be kind to one another, and as always, happy yarning. Bye now.